I got you. everyone, and welcome to our wellness series event. I'm physical therapist Katie Wolfley, and I have Gabby and Ashley with me today. We are talking about stronger core, stronger pelvic floor. Today, this conversation is going to be focused on education, understanding, and feeling supported. We're going to break down what the pelvic floor is and give some simple demonstrations that you can take home today to get started and working on your pelvic floor. So, you guys ready?
Yes.
All right. Can one of you ladies please explain to us what is the pelvic floor and its role, and how does it change over time as our life events affect it?
Yes. I love it. Let's get into it. So I'm going to grab our pelvic model here. Alrighty. So we can see here that we have our pelvis, front, back. So if I go ahead, I remove half of the pelvis here, we can see those lovely pelvic floor muscles that we focus on, as well as our pelvic organs. So pelvic floor muscles, they sit at the bottom of our pelvis. So they're like a little hammock or trampoline to help support these pelvic organs. So that's one of their first jobs, is support. So if I turn here, that we can see that we have a female model. So we have bladder, vaginal canal, uterus, and the rectum. And in addition to supporting these pelvic organs, keeping them in their place, we see that they surround the openings of these organs. So they're like any other muscle that they need to contract, and they also have to relax. So if you think about the bicep, when it contracts, it's going to bend that elbow, and when it relaxes, it lengthens and straightens the elbow. So then when we think about our pelvic floor muscles, when they contract, if you've ever heard of a Kegel before, so.
Go ahead, but we all.
Oh, yes. So that is a pelvic floor contraction where they go ahead and they close off these openings here. When they do contract as well, they help provide stability for the pelvis, and they don't work alone. So they work with the rest of our core muscles to do that. So that includes all of our abdominal muscles, glutes, hip stabilizing muscles, our diaphragm. And then on the flip side, as I mentioned, that they have to lengthen and relax. Yep. So that's going to allow us then to fully empty our bladder, our bowels, have pain-free insertion of any kind. And then other functions that it does is that it helps to bring blood and lymph back up to the heart. So pelvic floor muscles do a lot for us. So we can see we have 12 muscles in total, 6 on either side. Comes from the front of the pubic bone to our tailbone, sits bone to sits bone area. And your pelvic floor actually has 3 layers. So that more outer layer can be felt actually, externally over skin, but then the 2 deeper layers are internal. So us 3, we are internal pelvic floor therapists. Yeah. We also have external pelvic floor therapists within the company who, work a bit more with strictly urinary leakage. But if, patients are coming with symptoms that may warrant more of an internal exam, the best way to know what's going on fully with that pelvic floor, looking at the length of the muscles, strength, coordination, is going to be through that internal exam. So, they're like any other muscle that they can spasm, get trigger points, and then that tightness can contribute towards weakness as well. So I'm sure, we've heard from patients, my muscles are tight. Doesn't that mean they're strong? But
no.
Yeah, not always the case. So yeah, if you have a super tight muscle, that does mean it's weak, can't produce a lot of force. If you have over length of muscle, also same deal, that it's not going to produce a lot of force. So that's why we really want to take a look at that length of the muscle when a patient is coming in. And then we can also look at their strength, coordination, so we can fully determine what we're going to do moving forward with our patient. So then other things that can then contribute towards pelvic floor dysfunction as we're moving through life, aging, for one, that we are going to have those typical changes that occur that can influence the role of these muscles, specifically for women. Menopause or just hormonal changes in general. So estrogen plays a huge role with how these muscles function, as well as the, health of the vaginal tissue. So as that is a part of, aging and life, just being able to have that conversation with patients for maybe why they're experiencing symptoms, or maybe things to kind of, look out for as they go through that phase. Surgeries, anything through like the abdominal pelvic area can really influence things, because then too, if there's any scar tissue, any traumatic injuries, obviously pregnancy, antepartum, postpartum, those changes can influence our pelvic floor. Hugely, yes. Breathing mechanics, if you do a lot of breath holding. I had a patient who, she was taking care of her mom for several years, and just that, act of having to take care of her mom with the lifting and the moving, and over time that breath holding caused her to then have in the future a prolapse. So it's those sorts of things that, slowly build up over time, that, maybe it's just not an acute injury or something that causes it, but, a gradual over time, but everything can still be worked on at least. Yeah.
Even I kind of like that life event change. Like, it doesn't have to just be like, oh, I grew a child and gave birth, but I had to become a caretaker. You have little kiddos and you're doing a lot more movement, or when you're older and you're doing less movement, and all of that contributes to how does everything else function or not, and lead to the pelvic floor having those extra added issues.
Yeah, definitely.
Yep. Alrighty. So in regards to kind of putting some of those pieces together, what's a nice easy thing we can start with for getting the pelvic floor ready to do some movement?
Yeah, absolutely. So I'm going to walk Gabby through a few simple exercises that are great to start with, just to build a good foundation as far as correct diaphragm activation, as well as correct deep core activation. So we'll go through some diaphragmatic breathing first. Gabby, I'm going to have you lay down flat on your back here. So you want to make sure that you are on a flat surface. Knees are going to be bent so that feet are flat on the ground. And then from here, I'm going to have Gabby place one hand on her chest, one hand on her belly. Now, again, this is diaphragmatic breathing, so we're really working on, that full expansion of the diaphragm. But again, a great exercise to just help relax the pelvic floor and just bring good awareness to this area. So to begin, I'm going to have you take a big inhale. when you inhale, your belly is going to rise. And when you exhale, belly is going to lower.
Any preference for like inhaling through nose or mouth with like, and same thing with the exhale?
Yes, so when we take a big inhale, we're gonna breathe through the nose. So breathing in through the nose, belly rises. Exhale through the mouth, belly lowers. So again, just a really great exercise to bring awareness to our diaphragm, but also promote relaxation through the pelvic floor. Typically, I like to go through about 20 breaths, then resting after that, and then you can go through 2 to 3 rounds of that. Sometimes I'll also have patients just set a timer for about 5 minutes, just to really promote good relaxation there.
Yeah, right. I tell everybody that like you're just gonna be thinking about how you breathe, and afterwards you're gonna go, "Wow, I feel great."
Yeah.
It's gonna trick that nervous system into
Yeah.
that rest digest out of a fight and flight type of mode.
Yes.
And it just relaxes any stress tension you might be kind of like holding that holds that pelvic floor up. And right, the relationship diaphragm pelvic floor. I don't think people really know that, but with the inhale, diaphragm down, pelvic floor down,
Yeah.
so we get to take advantage of that relationship and say, "Hey, can we just like stretch and relax?"
Yeah, that relationship is huge between the diaphragm and the pelvic floor. They move and they work together. Another thing I like to make sure that people understand with this exercise is to really focus on movement through their belly. That hand on the chest should not be moving at all. So really emphasizing that deep belly breath to get that full length and stretch of the pelvic floor.
Fabulous.
Awesome. And then next one we'll go into is learning how to activate our deep core muscle correctly. So this muscle specifically is our transversus abdominis, or our TA muscle. It is a deep core stabilizer, works with our diaphragm, our pelvic floor, and some of our spinal muscles. Typically, to best feel this muscle, I like to do this exercise in the same position, but actually feeling the muscle, you can feel just inside of the hip. So I'm gonna have Gabby feel the front part of her hip bones, and then she's just gonna move right inside so that she's on more of a soft tissue. From here, I always like to cue a gentle brace of the core. So imagining like you're going to take a punch to the stomach, drawing belly button down towards spine. Those are little things that you can think about as we are activating this muscle. So I'm gonna have you try to brace your abdominal muscles for me. As you do that, we are going to do an exhale. So see if you can exhale as you brace. You should feel that muscle pop up under your finger, meaning that you're getting correct activation of the TA muscle. Great.
Yep.
And I'll tell some people, like, if they're feeling it, they're kind of like, I don't know, maybe, but other cues to look for, your back is going to become a little bit more flat to the surface. It's going to be a little bit harder for me to try and stick my hand between you and the table, because you kind of get that natural compression where low back goes into a neutral position. Nice, stable, flat.
And sometimes too, like before I'll have a patient cough, and they can feel that kind of like firm tensing into the fingers, and then I'll be like, that's what we're looking for, but obviously we want to do it without a cough. So
Just cough throughout your exercise.
yeah, that's it.
That's normal.
So then they're like, okay, that's what I'm looking for. Maybe it's not to the same extent of that like firming, but at least they can be like, oh yeah, like I am doing it correctly then when they go to actually think about those other cues.
That's a good one. Yeah, cough, laugh, sneeze muscle, so I like that. Or if somebody laughs while they're doing this too, I'm like, great, look, you're using it. Like, that's the feel.
There it is, yeah. Yep.
Perfect, awesome, thank you. We'll go on to our next piece. We'll bring ourselves back to the front here, guys. Next thing we want to discuss, why do pelvic symptoms often show up as back pain, hip tightness, or breathing difficulty?
So a lot of the time with that, it's, you know, the body's way of compensating, especially related to what's going on in the pelvic floor. So to give a bit more stability, maybe the hips are going to kick in a little bit more. Breathing mechanics, if we aren't allowing full range of our pelvic floor muscles because they're tight, that diaphragm maybe kicks in to be a bit more of a stability muscle, and we're going to rely on the pressure within our abdomen through like breath holding to give us that stability that we're you know, lacking elsewhere. Many of our patients, you know, they come in also having low back pain. That's a huge one. And again, that diaphragm, instead of it being a main inspiratory muscle, begins to compensate, and it's like, all right, I'm going to give more stability for the spine that my low back is not providing. So now that muscle, we're going to keep it steady. They become a bit more maybe chest breathers. So then, as you mentioned before, that diaphragm works, with the pelvic floor. With that inhale, it comes down. So should the pelvic floor. Exhale, they both come up. So now if we have that muscle, it stiffens. It's not going to move as well. You're not then taking your pelvic floor into full range. So then too, we think about how are we managing the pressure within our abdomen? Not very well. And then that's going to over time provide more pressure on pelvic organs, on the pelvic floor. So that's one piece of it. Another part is, active trigger points. If we have them within the pelvic floor, a lot of times, patients may not even feel their symptoms within the pelvic floor. It's going to be maybe referred to the hips, the low back, the abdomen. I've had that for many patients, or, when we go and assess the muscles fully and we, are looking at the length, with palpation, they're like, yeah, like I feel that in my abdomen, or that's recreating my hip pain. So it's like, maybe they've been seeing out, ortho for a while. They're, not making any more progress. It's because instead of it being a hip issue, it's really stemming from pelvic floor. And I also educate patients too that, you have a map within your brain. It's called the homunculus. It's a fun name.
I love that word, yeah.
And it's a map of all the body parts, but the places that we use the most, such as, our hands, mouth, eyes, takes up a big portion of that map. So your brain is more well aware of the sensations that come from there. And, when you injure something, you have pain, it's local to that area. But the pelvic floor is such a small part on that map that sometimes your brain is like, I sense there's an injury, I sense there's pain, but where is it coming from? True. So then again, it's going to refer to those other areas as well. So
becomes a nice big fun snowball effect of like all the pieces just compensating all over the place.
Yes, but it's always great when someone comes in and again, maybe they've had these issues for years and have tried to address, their low back pain, but then we have that aha moment like, oh, it's coming from the pelvic floor, and just that relief that there's, something that can be done, to help for them.
I've had even people accidentally improve their low back pain because of what we're working on with pelvic floor, and I'm like, look at that.
Yeah.
Mic drop. Okay, cool. So with all that going on, what are some nice easy things that people can start with that we're generally going to see a lot of those compensations and tightness in?
Yeah, so typically what happens when there is compensation, usually our hip muscles get really tight, our diaphragm's overworking, our back may be overworking, and that's where you lead to, that dysfunction and that pain. So I'm gonna walk Gabby through a couple just simple stretches for the hips, again, just to address some of that tightness through that area. So the first one we'll go through is a hip flexor stretch. We're just gonna do it in standing. So I'm gonna have you face this way, and then you can hold onto the table for balance if you need it. From here, you're gonna go into a stride stance. You're gonna put one leg in front of the other, making sure that both of your feet are facing forward. From here, you're just going to bend your front knee so that you start to feel a stretch through the front of the hip there.
Sometimes I'll tell people, they're like, I don't really feel it. Squeeze the booty on the back leg.
Yes.
Give that a nice little active squeeze, and that can kind of push that pelvis forward a little bit more, get more of that length in the front.
Yeah. I'm gonna tuck my tailbone under.
Yeah.
So you just go to that point where you feel the stretch, try to hold for a good 5 seconds, and then kind of ease off. Typically, I like to go through about 10 reps, and then you can go ahead and switch sides.
Yep, I feel like everybody's hips tend to get tight. And sometimes you're like, oh, my hips are tight because I sit for work or something like that. Yeah. And that can even compound the issue and, more compensations and stuff. But everybody's tight. Guarantee this one's probably gonna feel pretty good and help open up some spots.
Yeah, absolutely. Great.
Very nice. Yeah.
All right, the next one we will be doing is just laying down again. So Gabby, I'm gonna have you lay flat on your back. And this stretch is called a butterfly stretch. So another really great stretch to help relax the pelvic floor, but also stretch some of our inner thigh muscles. So from this position, you're going to put feet together and then just let the knees fall open. Great. So typically in this position, you should feel a good stretch through the inner thighs. I also like to do some diaphragmatic breathing in this position as well, so you can kind of combine 2 exercises into one. But again, just a really great exercise to improve mobility through the pelvic floor, but also through the hips.
Yeah. And I'll tell people too, if it's too much of a stretch or they can't relax, because that's the goal, right? You know, we're relaxing to place like pillows or, you know, build that surface up to you if, you know, you can't get down.
That full range.
Not everybody's starting with their knees solo to the table. Great job, yeah, but usually they're a little bit higher. Yeah.
Yeah.
And right, those inner thigh muscles, they're so, like, they come right up to the groin. They're so closely physically related to the pelvic floor, and then also does make them like a co-contractor.
Yeah.
Where they tend to be a little bit more overactive if our floor is overactive and like that tension is there. So lots and lots of tight inner thighs for all of our friends.
Yes. Yeah, definitely.
Yep. Fabulous. Awesome.
Great.
Awesome. Okay, let's move on to our next piece. Okay, we'll have you pop back up with us. All right. So, and Ashley, maybe you can answer this for us. How does pressure management influence symptoms more than strength alone?
Yeah, so I think a lot of times people will kind of have this expectation that when it comes to the pelvic floor, like Kegels is really like the only thing that you can do. But strengthening and, you know, squeezing your pelvic floor over and over may not be, you know, the root cause of what is truly going on. So yes, having a strong pelvic floor is great, but we want to make sure that we are working other muscle groups appropriately and working them together to provide good pressure management through the system. So that's including the diaphragm, including, you know, the hip muscles, the core muscles, and your spinal stabilizers as well. So it really is a full system, and all of those muscles do need to work together in good coordination to provide good stability and pressure management.
Yep, absolutely. All right. Can we do an exercise that kind of ties that together?
Yeah,
Pressure management.
Absolutely. So another good exercise is working through some bridging with a ball squeeze or a pillow squeeze. So I will have Gabby demonstrate again. So we'll lay back down here. Same position as some of the other exercises that we were working on. Laying flat on your back with the knees bent. And then ball or a pillow is going to go right in between the knees. Okay, so for this exercise, we are working the glute muscles a little bit. We're working some of our abdominal muscles, but as well, we are going to include the diaphragm to make sure that all of those structures are working together correctly to take off some pressure that is going into the pelvic floor. Okay. So from this position here, lift the hips off the surface. As you are doing this, important thing is to make sure that you are exhaling as you lift so that the pressure is coming out through the mouth instead of going down into the pelvic floor. So just a hold there, and then you can slowly lower. Great, we'll go through one more repetition. So again, squeeze of the ball, lifting the hips off the table as you exhale. Great. And then lower down. Awesome.
Fabulous. Sometimes they'll have, patients who are maybe like struggling with like, wait, you want me to do what all at the same time? Okay, laying down, inhale, exhale, bring that core intake kind of like we did with that last brace exercise.
Yeah.
And then give the squeeze in that, like breaking it up as you need to kind of make it all make sense in your body. But it's bringing all the pieces together.
Right.
Yeah.
For sure. I always tell people, I'm like, pelvic floor therapy is like coordination central. Like you will be so well coordinated once you're done here.
That's for sure. Walk and chew gum in like 6 different ways.
Yes.
Perfect. Okay, great. All right, and then let's come back over here. I'll take the ball for you.
Yep.
Thank you. All right. And our next piece. How do breathing patterns affect strength, performance, and daily movement?
So, you know, kind of coming off of what Ashley talked about with that breath. So exhaling on the effort of any sort of exercise, movement in your day-to-day, such as, you know, standing up from a chair, you're pushing something, you're lifting up your kiddo from the floor. Super important. One, it's going to help with, you know, Ashley mentioned alleviating any sort of additional pressure placed down on your pelvic organs, and then as well as the pelvic floor, so that air has somewhere to go, but then it's also going to help with the force production of all your muscles and get them activated. So it's great to work on coordination during exercises like doing the bridge with the ball squeeze, but then translating that over to like our functional tasks where we really need it. Especially if you are, let's say with the example of picking up our toddler, maybe who's 30 pounds. That's a lot of weight. And if we aren't using that breath, we're not probably activating our deep abdominal muscles. So then we're increasing risk of, placing a lot more strain on the low back. Those muscles aren't going to work as they should. We don't have that TA muscle. And then again, what's going to take the brunt of it is that pelvic floor. So we can spend a whole session sometimes on just breathing mechanics alone and going through the functional tasks. And a lot of times patients will be like, yeah, like this movement feels a lot easier now that I can, use my breath and do it together, because they feel their muscles actually working. And especially too, if I'm doing any sort of like weighted rotational stuff. So when we add rotation in, side bending, that's even more of that pressure coming down here. So it's always that nice exhale as we're doing it, just so we can, again, get that pressure out instead of going down, and, working our muscles more to help reduce any risk of, injury.
Yep.
So,
yep. Huge.
yeah.
All right. So maybe let's do a little bit of a functional training piece.
Yeah, absolutely. I am going to grab the chair behind you, so we will kind of bring this over to the center here. And then, Gabby, I'm going to have you demonstrate again, so I'll have you take a seat for me.
Alrighty.
So this exercise is a sit to stand, or almost like a modified squat. This is a good place to start if a squat is, something that you want to get into. Just having that chair behind you for some extra support is super helpful. So one big thing that we want to focus on with a sit to stand is our breath coordination with it. So as you are coming up, you will be exhaling. As you sit back down, you are going to inhale.
Okay.
Now, positionally with your hands, we like to just use no hand support. If you're able to do it, if you need hand support to start, that is fine as well. But you can either kind of cross your hands on your chest or just kind of leave them at your side. One thing we want to avoid is just pushing off of your legs.
Okay.
So again, as you stand from the chair, you're going to let out a big exhale. Good. So again, emphasizing that exhale with effort. And then you're going to inhale, slowly lower. Great.
I have a lot of people who will say that, like, if I tell them finally to like exhale as you're coming down, and then I'm also like, but try and do it quietly or sit really slow.
Yeah.
That they're like, oh my gosh, that's hard. And I'm like, well, you've been holding your breath trying to do this. So yes, it's going to be a little bit of like a, take some time to kind of coordinate, retrain.
Yeah.
But that exhale is going to bring in the deep core muscles and really just help everything tie in together.
Yeah, absolutely.
I forgot too that, when you exhale, again, we talked about before that both your diaphragm and the pelvic floor come up. So if that happens, it's almost like your pelvic floor is doing a little Kegel in a way. So we'll, educate patients, especially if they have maybe urinary leakage when they're doing like, a sit to stand from a chair, before you go to stand up, start getting that exhale, because that'll help with contracting your pelvic floor a little bit more and prevent against any sort of leakage.
All for any little assist.
Yes.
All right, guys, we're going to take a quick break. After we come back, we are going to get into a little bit more intimate conversation where we can hold some open space for some more discussions.
You saved my life, really. Oh, yeah.
My name is Diane Kraft, and the symptoms that I've experienced are pelvic floor pain, lower abdominal pain. Problems associated with that would be urinary incontinence and also sexual pain and discomfort. So before pelvic health treatment, I had sought out many different medical options, one being the Mona Lisa procedure, which was laser, and that did absolutely nothing to help with any of my symptoms that I had. I also sought a urinary surgeon who suggested that I go on medication for treatment because I was using poise pads and not being able to really go anywhere without knowing where bathrooms were, and constantly struggling with the embarrassment of bladder leakage. And my husband and I, we just ended up having no physical relations with each other for probably close to 10 years. So it affected everything in my life. When I heard about pelvic floor, Mary offered to take me on as one of her patients, and probably the biggest obstacle that I faced was wondering if it would even work. I couldn't imagine that PT could improve my life. I want to say and suggest to any woman who is going through this that there is help out there, and the treatment not only helped me, but it reversed every symptom that I had. I'm now functioning 100% with no medication, no surgery, no pads, and my husband and I feel like we're on our second honeymoon. I think we have to break the stigma of this whole entire physical situation that women face, because often by the time there is a discussion, depression is already involved, and understandably so. Your world as you once knew it is over. It really is over. It's changed dramatically. And most women don't want to talk about the fact that they need to wear poise pads at the age of 35, 40, 45 years old. And so I think I would say to them that you don't have to be embarrassed about it, and that there is treatment available that can eliminate everything that you're going through. I would encourage it for sure.
Hey everyone, welcome back. We have moved ourselves into a more relaxing space because this kind of part of our conversation deserves it. Pelvic health journey for everyone looks very different, and we think it's important to kind of recognize that that is the truth. Everyone's looks different. We know when patients come to us, they've maybe been to a lot of different providers already. We may not be their first stop. We may not be their 15th stop. But when they get to us, we like to create a very open and welcoming space where hopefully our patients feel comfortable sharing information with us so that we can really help them figure out what they need and to really make a difference for what they need, right?
Yeah, definitely. Yeah. I just feel like when they come into the space, and like all of our spaces that we have are like a good atmosphere. They're open, they're welcoming. You know, we have our own rooms. So I feel like some patients are like, oh,
True.
like, are we gonna be out in the clinic? Like they're worried, but we come into our own space. You know, I have mood lighting, you know, I don't have
True,
an overhead
yeah.
light on. We have like the lights off, some like nice music in the background, just to make it as comfortable as possible, because obviously it's not a comfortable situation. And just kind of letting the patient talk and share their story, because sometimes that's what they need, is just to be heard. And I always tell people, I'm like, this is a safe, open, and welcome space. So like, you know, I appreciate anything that like you share with me, given all the like, you know, vulnerability of it all, you know.
Yeah, no, and that can be really hard to do too. So yes, I appreciate that. Like, we appreciate that whenever our patients are like willing to do that and feel comfortable. And I've had people walk into the room and go, "Wow, this is nice. I had no idea." And right, like,
Yeah.
"Oh, I love this." Yeah.
Yeah. Yeah, they're expecting like the sterile like environment that maybe like in the typical
Doctor's
doctor's office,
Yeah.
but yeah, it's not that at all. which is nice.
You know, and I'm sure it's the same for you guys, but like we're happy to be a source of like helping people bring all of their things together. Like
Yeah.
they've met, you know, how many different providers that have all given different information, done different tests, all that kind of stuff. And we kind of help them like unpack all of that and figure out like what's most relevant to you in terms of what's being a part of the problem, what do we need to really work on, and just kind of make sense of it.
Yeah.
Absolutely. I mean, I'm always talking to my patients like, you're in control of all of our sessions. So like whatever they're comfortable with, we will just dive into that. But I think what we do is just a really good job of just creating that comfortable space for them so that they can, you know, let out things that they may be holding in for a while, or, you know, looking for answers that they haven't found.
Yeah.
So being, you know, a guiding, you know, professional as far as a physical therapist is super empowering to be able to, you know, really impact, you know, lives and notice changes with our patients. So I think that's super important as well.
Yeah, yeah. And I feel like we always ask all the questions everybody didn't think they were going to get like asked
Yes,
at their evaluations and visits.
Yeah.
We really dive into all the things and
and just provide like all the education that is lacking out there.
yeah.
Because again, it's a very common thing for, you know, females, males to hear, you know, your symptoms are normal. Like it's to be expected that you have this after having a baby, or maybe after having a surgery for the prostate, that's normal. But, you know, it isn't. And we have some of these patients who have had the symptoms for so long, and that's not to say that we can't help them, because obviously we have many patients coming in who their symptoms are chronic, and we do make a change, you know, in their lives. But just giving them that education and for their realization to be like, oh my gosh, like I didn't know that. And it's really like warming to be able to do that for our jobs.
Yeah. And I think even in the realm, like especially with relating to some of the men that we see, like you don't often see a ton, but and that's, you know, there's a lot surrounding all of these intimate and vulnerable things, and like to be able to come forward and say, you know what, I have a problem, I'd like to address it, and then seek out that guidance, and then they make it to us, and to then like ask all the questions and help them really figure out what's going on. But that we help everyone, males, females, young ladies, older individuals, women who are, kiddos, yep, Gabby, have a bunch of those.
Yeah, because I know I had, you know, talked about obviously the anatomy and stuff a little bit earlier with the pelvic floor, and this is a female model, but I mean, all muscles are the same in males, besides the one that, you know, surround kind of that, you know, urethra. We would have it surrounding the prostate for males, but yes, males do have a pelvic floor. I feel like that's sometimes a shock. Like, I didn't know I had those muscles down there. Or, you know, I was just having a patient the other day who I was like, all right, we're going to do Kegels. And he was like, what? I thought that was just a female thing. And it's like, no, Kegels, you know, anyone can do a Kegel. But again, it's that educational standpoint that a lot of people don't receive. So
yeah. So we're happy to be that place. Hoping that some of you guys, if you need it, come on in and be able to have that education and that personal touch to it.
Yeah, just the conversation. Because even I've had where it's, you know, that first session, I am just talking to the patient, because maybe they have like a lot to, you know, say. There's a lot of education to be given, and I'm like,
that goes a long way.
Yeah, and I'm like, when you come in next time, like we'll do, because I never want to rush, you know, an examination. No. And I always give people options for that exam, which like you guys do as well. So if they're not open to, you know, an internal examination at the time of their first appointment, I'm like, we can do it next visit. We can do it in the future. Like like you said, you're the one in control. Yeah. So not making them think that they're forced into doing, you know, something just because, you know, it's, you know, recommended, but they have options.
Yeah, no, I think that's huge. Awesome. All right, guys, how about we talk about some of what we do. So how do our clinicians assess pelvic health without isolating one muscle?
Yeah, so I know we've kind of talked a lot about this already, but there is a lot more to just the pelvic floor, right? There's a lot of other muscle groups that need to work together in order to provide good function, good stability, and good pressure management through the system. So as a physical therapist, we like to look at, you know, the full body, right? So we don't just look at the pelvic floor alone. We look at, you know, your sitting posture, your standing posture, maybe how you are walking and moving, looking at how the body moves from a sit to stand. stand, or maybe a squat and a lift. All of those functional movements are things that we look at to make sure that all of our muscle groups are working, correctly and in good coordination. So it's not necessarily about like how strong can these muscles get, but are they truly working together? And, what little tweaks do we need to make to, transfer over to better functional tasks and functional movements as well.
Yep. Whole body, whole organism.
Oh yeah.
All right, and our next thought. How do Kegels fit into pelvic health, and why must they be supported?
Kegels. Yes, I feel like the number one thing that anyone thinks of with our pelvic floor therapy. So Kegels do have a time and place for sure, but it may not be the first thing that we're going to jump to with a patient right away. So as we kind of talked about earlier, that you can develop those trigger points, the tension within a muscle, and we talked about that if you do have a tight muscle, it doesn't mean that it's strong. And I think that's, again, another huge educational point that we're giving our patients. If you do have that tight muscle, we need to lengthen that first, because we need to get it to that, point where the muscle is able to produce enough force. So it's kind of like, getting that bang for your buck, that if we are trying to do Kegels when we're in this shortened state, if we're to be thinking of the bicep, for example, I'm not going to move anywhere. So I'm just going to make this tightness worse, and I'm not going to get any stronger. But if we can help to lengthen that bicep a little bit more, think of all this range now that we have to fully work those muscles and work the coordination. So, for those folks that we're lengthening first, and then when we get to a standpoint where we're not having those active trigger points, we can, put pressure on a pelvic floor muscle and they don't get any of those like symptoms. We don't notice any of that tension. All right, then we can go to strengthen it up. But some people, if they don't have that, yes, maybe we can get, into Kegels right away. But as we talked about earlier, that Kegels alone aren't the only thing that are going to improve your symptoms. That, we've had patients that maybe, Katie, you had mentioned earlier, having a patient that maybe they have like a good baseline for strength when we assess them.
Yeah.
And yes, they are appropriate to strengthen, but they've given us in the subjective that, I've been doing Kegels for so long and I still don't notice a change in my symptoms. But then we go to work on those other things that you've talked about, Ashley, and that we've gone over in exercises, that then down the line, they start to notice an improvement in their symptoms, or maybe we're getting overflow from other muscle groups to help activate those pelvic floor muscles more. So yes, Kegels are a small piece to the puzzle, but it's not the only thing. Yeah, the end all be all. Yeah.
Or I've had patients who, like, upon initial testing are like very weak. And I'm like, all right, let's start at the very foundational stuff, those breathing patterns, some of the core, what are our hips doing? We start putting those puzzle pieces together. And without doing Kegels as a part of the program, like you go back to strength testing and we're like, look at that, it's stronger. And we didn't even do a single Kegel.
Yeah.
And we're providing all of those like tools in the tool bag that helps your pelvic floor do pelvic floor things and just be more effective at it, because that's what the whole system is lacking, not just those muscles.
Mm-hmm.
Yep.
Absolutely.
And why does improvement take time, and what influences progress?
Yeah, so when we're talking about the pelvic floor, I think it's important to understand that a lot of these patterns that people have been doing have been going on for a long period of time. So it's not necessarily like an acute injury, like you sprain your ankle or you tear a ligament in your knee. Those are more acute injuries, but a lot of what we see in pelvic floor therapy are more chronic, chronic issues that they've been dealing with for a while and just haven't fully addressed. So understanding that these things have happened over time and maybe have progressively worsened over time, it's important to realize that it may take some time to make changes through the system. So a big thing with pelvic floor therapy is just being consistent with it, really working on those good foundational things, the coordination, making sure all muscle groups are working together. It's not necessarily about a quick recovery or a quick change, but just being consistent is the best thing for it. And that's kind of where we come into play too as pelvic floor therapists, is really giving that guidance and giving that consistency to at least get them started, to make sure that they fully understand what's going on and what direction they need to take.
Yep. I tell my patients a lot of times when they're thinking about homework and stuff, like it's like, I don't need you to do everything all in one day each time you go to do it, but like if we can do a couple each day, it's that keeping on it consistent, building, that really makes the difference over time.
Yeah,
So,
yeah, absolutely. I think it's a lot of, just trying to retrain things, get things to work more efficiently, more effectively, and then eventually it kind of crosses over into functional tasks. So, seeing a pelvic floor therapist can really help, point you in the right direction, truly figure out what the root cause of maybe the dysfunction is, and then, going from there.
Yeah. All right, and what do you guys think are some of the misconceptions or maybe misunderstandings about like what pelvic health is and what our patients run into that can impact our availability to give care, things like that?
Yeah, so I think, most people don't always know about pelvic floor therapy, or sometimes they'll even bring it up to their providers, like, hey, is this something that would be helpful for me? I've had a lot of patients say, I've seen things on social media, but I just don't know what I should be doing and that sort of thing. So I think just understanding that this is an option of treatment, it's super, super important. It can be very helpful to prevent, future issues, prevent surgeries, prevent, all sorts of things. So I think it's just important to know that there is access available. We have a lot of therapists within our company alone, so and we do take insurance as well. So just having that availability for our patients and understanding that this is an avenue that they can take is super powerful.
Yeah, I think too, like if they are having any sort of pelvic floor symptoms, again, kind of talked about it earlier, is like with the Kegels, that they were told just to do your Kegels. So I think that's like the first kind of go-to is to try that.
Slap some Kegels on it,
yeah,
that'll be better.
yeah, right? So then when they like come in to see us, they're like, I was told to do my Kegels, like I thought that's all the pelvic floor therapy was. And as we talked about, obviously there's more to it. But yeah, I feel like they just bring up that conversation themselves to their providers, like, hey, like I heard about pelvic floor therapy. Do you think it would be helpful? And a lot of the times, like, their doctors are like, yeah, let's give it a try. But hopefully more in the future, we get that initiation from like all those providers and just, more growth and knowledge about like everything that we can cover. Because I think even when like I've gone into this profession, I didn't even know that it was going to cover things from urinary to bowel to sexual health to everything with the breathing mechanics and lifting. Like I didn't even know myself it was going to cover that much. So I think if we can help to expand that knowledge of everything that we can work on would be helpful, so then other people know, like, yes, like a pelvic floor therapist can cover that, not just urinary leakage.
Yeah. So I feel like a lot of conversations between like friends about like, oh, I've heard about this, or yeah, I went once, and like sharing experiences is all really helpful. So self-advocating to your providers, having those conversations, definitely huge. And yeah, just kind of spreading the word, because we're unfortunately not heard a lot about.
We're the unicorns of the world.
Yes. Oh, I like that.
Yes.
All right, well, this has been a really great kind of format for discussion. Glad we could have all these conversations. We hope that they've been helpful to you guys and you're taking away some good bits with you today. We're going to take a quick break. So if you guys are having questions, have any more that have been filling your brains, please put them into the chat. We are going to answer them next in our Q&A session.
Thank you for watching our free online class, Stronger Core, Stronger Pelvic Floor. Our live Q&A will begin in just a second. Be sure to register for our final remaining class during the 2026 YMCA Wellness Series, Healthy Aging Made Simple. And now for our live Q&A.
All right, everyone, thank you. Welcome back. We're going to get through our live Q&As. Oh. Okay. We're going to get through our questions. You guys have been putting them into the chat, and as we continue to move through these, if you have more, please put them in there. We'll continue to get through what we can tonight. So, guys, our first question, I think relating back to the exercises that we did, would like to know, can these be done every day? And if so, how many times a day should I be doing them?
Yeah, so I would say it depends on the exercise that you are doing. Typically, if it is a mobility-based exercise, then we will typically tell people to do those every day. It's safe to do those every day. And then when it comes to more of our strengthening exercises, really like 3 times a week is good because we want to make sure that we have appropriate rest days for those muscles to recover and build their strength as well. So really just depends on the type of exercise that you are doing. But with the help of a physical therapist and kind of developing a good program, you'll have that guidance of when to do certain exercises.
Absolutely, and I would say for some of those things, right, it's like depends on the person and what our goals are at that time. So yes, a PT would be great. Okay, next question. How does incontinence affect the pelvic floor?
So good question. Gonna reframe it a little bit. So pelvic floor is what really affects and can cause that incontinence. So, you know, if that pelvic floor does become tight, if it becomes weak, it's not going to function as it should because it does surround that urethral opening. So when we are, you know, doing a workout, you go to cough, you have urgency, you need to make it to the bathroom, that pelvic floor has to be strong enough to kind of, you know, kink that urethra to then cause, you know, leakage not to happen. But if it's not functioning as it should, it's not going to give that nice squeeze and it's going to cause incontinence. And that could be urinary and it could be bowel as well. And then also too for our male patients that the prostate does also have an involvement where, you know, if with aging it becomes enlarged, that then can compress the urethra itself. And, you know, when that happens, a lot of times males don't experience issues like incontinence, but if you do go to have any sort of procedure to, let's say, remove any of the extra tissue or completely remove the prostate, then that's where we can start to experience a lot of incontinence because, you know, the pelvic floor is shut off because, oh, I have support from the prostate kinking off the urethra, so I don't need to do my job. So then when they're called on to work, then again we have that leakage happening. So
Yeah, hope that helps answer the question. If you guys have any more questions to that kind of structural anatomy stuff, swing away.
yeah.
Okay, next question. This viewer says, I have both hips replaced. Can I still do these exercises?
Yes, absolutely. Obviously dependent on how far out of your surgery you are, and as long as you don't have any current precautions, that's always something just to be mindful of. But if you ever need to modify exercises, that is totally okay. We want to make sure that we're staying in a comfortable range, so we are getting at least a good stretch and you know, working the muscles appropriately, but not going into the range of motion that might create some, you know, sharp pain or something like that. So just understanding like where your limit is as far as mobility and strength, and just kind of maybe starting a little bit at like that lower stage and just progress based on how you're feeling. So
Yeah, like I can imagine if this is in reference to like the butterfly stretch, that how Gabby said, like prop pillows and things underneath the knees so that those legs are feeling supported. Meet your body at wherever it's at.
Yeah.
And something like the stretching the hip flexor would be great for honestly a total hip, but like to that comfort zone, not going past any precautions if you are still on any, but absolutely just those little tiny things about how far apart are my legs in that stance. Those can definitely help get you through the stretch so that you can do what you need to do, but without pushing any red buttons.
Yeah.
yeah.
Okay. Next. I am unable to get on the floor. Can these exercises be done using a chair or a bed?
Yeah, so feel free to modify however you need to. A lot of our patients aren't able to get on the floor, so the bed is like a good option. Sometimes if it is a bit softer, it can be a bit more challenging just from like a stability standpoint and kind of, you know, especially with like the core, kind of feeling what's going on. So you could do it on the bed. A chair is also a great option. Are there any like other modifications you guys have given patients?
For someone who could get up and down off the floor but felt that her bed was too soft, we talked about like taking a blanket and at least folding it over twice and like having that be a comfortable thing to lay on the floor. If it was just a matter of like floor's too hard, bed's too soft,
Yeah.
Goldilocks, let's put something soft on the floor and lay on top of that. And then like sometimes there can always be the option of a couch if you got it.
Yeah, yeah. If it's a firm couch,
Yep.
that works. But
Yeah, that's my thought. And is it better to do Kegels lying down or sitting? Is there a right way to do them?
Yeah, so when it comes to Kegels, there is a lot of different ways that we can challenge those muscles in different positions. Oftentimes we will have people start just performing them laying down because one, awareness is a big piece of a pelvic floor contraction, so just making sure that we are fully aware of like where the pelvic floor is, and sometimes laying down helps those other muscle groups relax a little bit. So typically we'll start people there, and then it's also really dependent on where your strength is at. So sometimes we'll go through an assessment and we'll find that somebody has a pretty good pelvic floor contraction and they don't really need to do them laying down. We get them up and moving right away. So sitting, standing, walking even, you can throw it into stairs or a squat, you can really challenge those muscles in different ways. So it is dependent on obviously where your baseline is as far as strength levels, but that's kind of something that we dive into a lot in pelvic floor therapy.
Yeah, and sometimes we'll even find that as we're working through like progressions with patients, maybe we started laying down, we moved them into sitting or standing, and all along the way we're kind of checking in on like what are signs and symptoms doing, are there any changes that might be like showing us negatively that like, oh, maybe we pushed a little too far too fast on maybe how many or the position itself. So even in that context, like being able to link up with your PT to be able to go through that personalized plan of how, when, why can really be helpful. But it all depends on the person and where you're starting. All right. When you come in for therapy, do you spend a lot of time and visits on breathing exercises?
definitely, especially in those first few visits. I spend a lot of time just making sure that it sounds crazy, but a patient can breathe correctly, especially being able to initiate like through the belly. So we call it like diaphragmatic breathing, which I know we talked about as an exercise. So we'll go through that a lot and then bring it into more of our like functional tasks. I mean, when we're doing exercises, it is a huge thing with my patients that I'm always, seeing, are they coordinating their breath with the movement? If not, we're kind of providing that cueing, and hopefully over time we get that translation over and the patient is learning to, give that feedback themselves. So yeah, maybe spending a bit more time like educating and really, teaching the patient how to breathe during exercises, and then just still trying to incorporate it in as we kind of progress things forward. And then as mentioned with the functional movements, maybe with more, lifting, bending, squatting, things like that. Mm-hmm.
Yeah. I'll even spend a couple of visits doing like breathing in different places, breathing into your sides, breathing into your back, and kind of like retraining diaphragm to be able to give full mobility, because your diaphragm and your pelvic floor move together. So obviously those breathing exercises become really important for just making sure that relationship is kind of exactly what it should be. Yeah. This viewer says, I have a rectocele and was wondering if it would help rather than getting surgery from a gynecologist.
Yeah, absolutely. So I would definitely recommend, coming in to see one of us, dependent on kind of the stage of the prolapse as well. That's something to consider. But if it is kind of those lower grades of a prolapse, we have found a lot of success in what we do just with all of those techniques we talked about, the breathing mechanics, understanding how to manage pressure correctly in your system, with also, strengthening up the pelvic floor as well. So it doesn't hurt to come in and ask for some help and ask for some guidance, even if it is just a little bit of working on pressure, pressure management. How can I manage the symptoms I'm experiencing? Those are all things that we dive into as well.
Yeah. And it's not to say like those later stages we can't help, and if it means still like, down the line surgery, coming in to see us, because we've had patients where, the end goal is having surgery, but they're in beforehand, and it helps put them at a good, prior level of function. Pelvic floor is nice and strong because, any sort of surgery or trauma to the area can affect your pelvic floor muscles. So we want to make sure that they're, in a good spot before having that surgery. So then afterwards, they're still kind of in a good spot. And if you need to resume any sort of therapy, kind of already have a good baseline. Yeah.
Yeah. Or if you're in one of those middle zones too, it's even good to like get started, see what we can achieve. And if we find that you've made some gains but you're not where you want to be and it's still a good choice between you and your practitioner to like go ahead and do surgery, cool. This worked as prehab, kind of like you're talking about.
Yeah.
And then you're already linked up with us so that in the future, if we do then go in for a therapy after surgery, you're already set up and you kind of know where you're headed with things. So absolutely, definitely would recommend in that case. All right, guys, thank you so much for all of your questions. We hope you've learned something today. We have many more things we could share with you too if you guys do stop in and see us for visits. Would also like to kind of present for you guys upcoming, our next wellness series event is going to be on Tuesday, April 28th, Healthy Aging Made Simple. So we're going to provide a lot of realistic habits to help build strength, improve your mobility, and maintain independence so we can stay active and capable as you age. Hope you guys can join us for that. You can sign up online. And otherwise, thank you for joining us tonight.
Thank you so much.